Hello, orthopods. Put down your crayons. So I wanted to talk a little bit about the RMSK examination that is open to PTs. It has been for about 5 years, and to my knowledge, only about 25 physical therapists have actually bothered to go and take and pass it. I think that is much more to the fact that no one from our profession is taking it, rather than the fact that it's so hard that only 25 people have passed. So I wanted to go a little bit over the content, who can take it, what you need to do in order to take it, because I looked through a lot of YouTube and a lot of other places, and there are great resources for learning to how to actually do the scans, what normal tissue looks like. Little scanty on some pathology videos, but there's tons of people turning out a bunch of great content, which I would highly recommend. There's the AIUM, there's Sono seminars, there's the ASKU, who is out in Arizona. Shout out to Colin. So there's tons of great resources, but there wasn't any that specifically prepared people for what on earth the RMSK exam is and why they should take it and how. So that's what I wanted to go into. So first of all, it's done through the Alliance for Physician Certification and Advancement. First question might be, well, I'm not a physician. Second, or the first answer is, doesn't matter. The sports section has been working with the AIUM to get us to do this almost 10 years ago. And the fact that we just kind of got in without anybody noticing is a testament for how under observed this skill is. So cool, let's look at it. Who can take this sucker? Pretty much any interpreting healthcare provider. You've got all the acronyms MDDO, DPM, DC, NP, DPT. I got to admit, I'm not exactly familiar with what an MBBS is, but that's probably what I'm going to do next. So basically, if you can look at a patient after looking at an image and say, hey, I think it's X, you can probably take this exam. So in order to actually sit for it, you have to perform about 150 musculoskeletal ultrasound studies within 3 years. So it seems like not a lot over 3 years, but it's unless you do them constantly and you're in a practice that really supports that volume, it can be a little bit troublesome. So for the types of providers that do injections, there's a limit on how many can be interventional because they really want you to have the diagnostic chops to support this. So they recommend you also take some continuing education, just to kind of weed out some of the people who are just really good at test taking and might have gotten lucky with it. So that's kind of who can take it and what you need to do it. The other thing that I believe they just added recently within the past year or two is you have to have a letter of attestation, basically someone vouching for you and saying, yep, they've done all the things, they're good to go. So you might want to get in touch with somebody who has already taken the exam to help you out, which if you reach out to me, I'd be more than happy to introduce you to some of the people that I found over the course of a couple years. So next up, what on earth is this exam and how do I study for it? So if you look at the breakdown, if all you do is know what normal anatomy looks like and you know what pathology looks like, that's half the exam right there. So that does cover a lot of ground, and there's a lot of breakdown of other categories, subcategories for these. But that's a lot of the meat and potatoes. So the other big section is physics and instrumentation, which goes into some of the theoretics, less clinical application, but more along the lines of how does sound affect or interact with different types of tissue, which puts the picture up that we look at and interpret. So knowing stuff like how fast does sound travel through different types of tissue, what types of artifacts or technological limitations on the picture happen, and those types of things, all super useful. If you change where the focus is, how does that affect the resolution? All of that stuff that you might have slept through during some of the physics pre-course work that you had to do before you applied to PT school. It's time to dust off some of that and get back to it. So 18% is also ultrasound-guided interventional procedures, which we don't do interventional procedures as PTs. However, it is pretty useful because if you ever use this in conjunction with someone who does injectables, you're basically familiar with the most common techniques, approaches, so you can kind of hold the probe for them if they don't either know how to use ultrasound or they just don't have the dexterity to do both at the same time, or the patient's, just not conducive towards making it happen with one person. So last one, integration of data. Hard to tack down from the practice exams and from the description. What I really think it is it's just kind of good old-fashioned clinical decision making, where they'll ask you about how different situations and questions you would judge it. So it's not a huge part of the exam, but from what I recall, it was like, if you see this, how would that change your management? Or, this person presents with X and Y. So it was much less rote memorization or anything like that, and it was more situational, very much like, the OCS exam is. So that's the basic overview, who can take it, what the general breakdown of the categories are. I'll make some more stuff as I get deeper into studying about the specific categories and other ways you can go about studying for it.